to speak with all of
you.
Yeah. I am going to go ahead and share my screen so I can share my presentation. And let me just make sure this looks right. All right, can everybody see that okay?
Yes, we do.
Okay, perfect. Well, I will go ahead and get started here. Good morning or good evening. Morning for me, evening for you. And thank you again for making the time to join me. I love talking about policy, so I'm been looking forward to this. So this is a quick overview of what I'll be doing for the next hour. So I'm going to start with a little bit of background briefly about me and about the purpose of this presentation. Then I'll be getting into what I call Policy Mapping 101. So I really want this to be a practical and useful talk about using this methodology. So I'll be defining what is policy mapping, then really spending most of the time going over the basic steps of how you can use this, how to apply it. And as I do that, I'll be using a couple of examples from my own work, and I'll talk quite a bit more about that shortly. And then I'll end it by talking about some next steps, things to consider if you're thinking about using this methodology in your own work, and some tips for publishing policy mapping research. We should have some time at the end for questions and answers, but please also feel free to just unmute yourself and ask a question, especially if something doesn't make sense. I'm happy to pause and clarify things. So just briefly, a little bit more about me. My background is in social work, and so I had been working as a social worker before I even thought about getting my PhD or going into research. Specifically, my background was in working with people experiencing homelessness. And through that, I really started to see this strong connection between homelessness and different kinds of health issues. So I did that as a practitioner for a while, and then eventually got interested in continuing to advocate and work on these same issues of health and homelessness, but from a research and teaching angle rather than being a direct practitioner. So I got my PhD from the Jane Addams College of Social Work at University of Illinois at Chicago. As Aslıhan mentioned, that's of course where we were fortunate to meet. And I'm currently an associate professor at the University at Buffalo School of Social Work. And I've been there at Buffalo pretty much since I got my PhD. My research looks at different aspects of housing as a social determinant of health. So looking at that connection between health and housing, looking at some of the health disparities that affect people that are homeless, for example. Within that, I have a special interest in addiction and recovery as something that disproportionately affects people that are homeless, but of course affects many other people as well. And I think I've always had an interest in looking at these issues from different angles. So some of my research approaches these things more at a person level or individual level, but I've also always had a strong interest in policy and policy analysis. So I've tried to weave that into my research agenda. And within that, I have a special interest in using something called trauma-informed perspectives to look at policy. And that's something I'll talk about more a little bit later in the presentation. The picture here, this is just a mural that I like a lot. I took this picture in San Francisco. The mural is called Everyone Deserves a Home. So just to say a little bit more about the purpose of this presentation, this is relatively short. We have about an hour together. My hope is that this can spark some interest in using policy mapping methods. Maybe you already know something about policy mapping. That may be why you came here today, to learn more. Maybe you've never heard of this and you are curious. Either way is fine. I just hope it will maybe spark something, and that perhaps some different research and different ideas may come out of that. As I mentioned, I'll spend most of the time kind of going over a basic overview of how to do policy mapping, what I call Policy Mapping 101, and illustrating that with some examples. I did want to offer a caveat that because policy mapping has that word mapping in it, I think people sometimes think it means geographic mapping, like using GIS or some other type of geographic analysis. I don't know why it's called policy mapping. It's not, I did not come up with the term, but here mapping is more metaphorical. So mapping meaning systematic analysis. So this is not a type of geographic analysis. I'm sure there are different ways to look at policy geographically, and that could be very interesting, but that is not what we're covering today. And I also wanted to be clear that I don't consider myself to be a total expert in this. This is one method that I use in my work. It's not the only method. I initially became interested in policy mapping. I had never heard of it during, my PhD or my studies. And then a couple of years ago, I was reviewing an article for a journal that happened to use this method. And I thought, oh, that's interesting. And, I learned a lot just from reading that one article, and then decided to learn a little bit more and kind of teach myself how to do this. So I have used this in my work, but I would not say I'm someone that, uses it all the time or exclusively. So I say that just in the spirit of humility and transparency. And I think you'll learn something from this presentation. But of course, I think in an hour, this will not make anyone here an expert either. So I just put that out there. So let's go ahead and dive in. So what is policy mapping? So this is kind of the official definition, and then I'll say a little bit more about it. So policy mapping is a methodological approach in which researchers apply systematic content analysis techniques to track and draw inferences about the content of policies in a given topic area. And I've highlighted the words systematic and content analysis because I think that's what's really key. So systematic, meaning this is, follows kind of a step-by-step protocol. There's a way to do it. There's certain steps that you can track and reproduce. And then I've also highlighted content analysis because that's really the broader methodology from which this stems. So some of you may be familiar with content analysis. It's a very broad and widely applicable field of methodology. There's some great books and great resources out there on content analysis. Content analysis can be applied to pretty much any kind of content. So I've read content analysis studies looking at newspaper articles or other types of media, for example. So policy mapping is essentially applying that idea, applying content analysis, specifically in the area of public policy. And by policy, that also can be quite broad what we mean by that. So generally, I think the most common things that get analyzed with policy mapping are laws, so legislation, including proposed legislation. So it may not only be things that are actually passed to become law, but ideas that are suggested or proposed. You could also, though, use it on other things like resolutions, things that are more symbolic, court orders, legal rulings. So there's not really a limit to the type of policy that one could use with policy mapping. The goal generally is to surveil policy and then scientifically evaluate and inform the policy response. And that part I think is really important because generally policy mapping is not meant to be just academic, but to have really a real world and real time application. So you're looking at real policies, usually recent policies, and you could use that analysis to advocate or to inform the ongoing policy response. At least that's the hope or the idea. I don't think any one academic discipline owns policy mapping. I do see it kind of most closely aligned with public health. So the majority of examples that I've read of policy mapping have been in public health journals, for example. A lot of the resources on policy mapping come out of public health, but it's relevant to really anything topically. So I have a colleague who's used policy mapping to assess educational policies, for example, or you could use it to assess economic policies, or really there's a range. As I mentioned, systematic, meaning it follows a transparent and reproducible protocol. And something that I'll talk a little bit more about is that policy mapping can have different degrees of objectivity or subjectivity. So when you're analyzing policy, some aspects are pretty clear and apparent. There's not many ways to interpret them. And I'd say that's the more objective type of analysis versus other kinds of questions that you might answer through policy mapping might involve a lot more subjectivity and interpretation. And it's a flexible enough methodology to be used either way. So I'm going to go ahead and continue unless there are any questions. So these are our 8 steps of policy mapping. And I'm drawing here from an article that I recently published with some colleagues this was intended as a primer for policy mapping, meant to be like an overview for social workers. I'm happy to pull up that article later and provide a copy of it if anybody would like it. So in any case, though, that's what I'm drawing from, and that's what I'll be primarily talking about here, is going through these 8 steps. So the steps are, number 1, identify a research question. 2, identify a data source that you can use to answer that question. 3, specify your inclusion and exclusion criteria. 4, come up with your code book. So develop coding categories and a coding process. 5, actually put together your data set based on all of the above. 6, do the coding, including tracking inter-rater agreement if you're coding with 2 people or more. 7, analyze your data. And then lastly, of course, write it up for publication and dissemination. So I'm going to go through and talk about each of these steps in a little more detail. And as I do that, I'll be sharing some examples from my own work. So the primary paper that I'm going to talk about is this one, which I published with my colleague, Andrew Irish, in 2019. This was in the International Journal of Drug Policy. And the title of the article is "A Policy Mapping Analysis of Goals, Target Populations, and Punitive Notions in the U.S. Congressional Response to the Opioid Epidemic." So I want to just briefly say a little bit of background here. So the opioid epidemic, I imagine we're all familiar with in the United States, as well as in, I know, many other places. We started to see a huge increase over the past decade or two in the number of people becoming addicted to opioid medication. And so it started with opioid prescription pain medication. And then a lot of people also went on to develop problems with illegal or illicit opioids, such as heroin. And so this really started because beginning in the 1990s, in the US at least, there was a huge increase in doctors prescribing these medications. They were really overprescribed. And then a lot of people went on to develop problems with that. So addiction issues, people overdosing, it's been a huge issue. And it, I think, is not talked about quite as much now, but it is certainly still going on in the US and elsewhere. So I was interested in this topic. Addiction is one of my interests.
Mute yourselves, please.
Okay. And please feel free, though, if anyone does have any questions, please stop me. But in any case, a couple years ago, we were, I think, hearing more in the media about this issue. And specifically, I was hearing a lot of politicians in the US talk about it. So it seemed like every politician wanted to say, oh, this epidemic is terrible. We need to do something about this. I care about this issue. We must do something about the opioid epidemic. And I just was hearing that type of talk a lot. And I became interested in, really digging deeper. So, okay, politicians want to talk about it, but what are they actually saying? What are they really suggesting that we do about it? And there wasn't really any thorough analysis of that. And then I learned about this technique of policy mapping, and I thought this would be a good topic and research question to use this methodology with. So that's really the origins of how I got involved in this. And so I'll be describing a little bit more as we go through the steps about this particular paper and this analysis. So before I do that, I don't want to get into the weeds too much here, but I did want to briefly explain a few things about policymaking in the US, just to give you some context, and it might be useful as I talk further about that example. This might help you to better understand it. So just going over a few basic things, because I know this is often there's commonalities, but this can also be different process in different countries. So this is kind of the basic policymaking process at the federal level. So we're talking about the whole United States, not any one particular state. So a bill is a piece of proposed legislation. So that's what can potentially become a law. And how that happens in the US, what we refer to as Congress is 2 different chambers, the Senate and the House of Representatives. So a bill can start in either one. So a senator or a representative has an idea, they can draft their idea and propose a bill. So they introduce that. And then the next step is that it has to go to a committee and it has to be voted on in that committee. So if it doesn't pass that committee, that's the end of the road. Nothing happens, it kind of dies, it doesn't become law. If it gets voted on with a majority positive vote in the committee, then it moves on to either the entire Senate or the entire House. And the whole Senate or the whole House discuss it and debate it, and then they vote on it. And then it also needs to pass that vote. So if it passes that vote, then it goes to the other branch. So if it passed the House, then it has to go to the Senate or vice versa. And so they can, at that point, the other chamber can suggest some minor changes if they want to, and then they vote on it. And then it also needs to pass that other chamber. So it needs to pass both the House and the Senate with a majority vote. And if that happens, then if there were any revisions or any differences, those get reconciled. Then finally, it goes to the president. The president signs it, and now it's a law. So that's the process. The president also has the ability to veto it, in which case it does not become law unless Congress chooses to override that veto, which they need a 2/3 vote. So that's just a little bit of background that may be relevant as I dig into a little bit more of my example. So if there aren't any questions, I'm going to continue with our steps of policy mapping. So the first one is just come up with your research questions. And as I mentioned, these can involve different degrees of subjectivity or interpretation. And I think you'll see that in this example. So in the study that I just mentioned that we published in 2019, these were our research questions. So number one, what are the main goals of policies made in response to the opioid epidemic? And that's really where I started from, of wanting just to dig into, okay, politicians are talking about it, but what are they really saying? What are they trying to do here? The second question that I thought of, which is kind of related to that, is are there specific populations being targeted? So families, children, younger people, older people, populations that are marginalized, such as people of color. I was curious to see, are there specific policies targeting different groups, and what does that look like? And then the third question was, to what extent is the policy response to the opioid epidemic punitive? And I was interested in that because in the United States, we have this history of policies known as the war on drugs. This started in the 1980s. These were very harsh, very punitive policies that required long jail sentences, things like that, for people that had drug problems, that were caught even with a small amount of drugs. So we have that history of having very punishment-oriented policies around drug use. But the times have changed somewhat. It seems like those policies haven't worked all that well. They're less popular now than they were in the 1980s. So I was curious, are the policies today for the opioid epidemic, are they similar? Are they punitive? Or are we really doing something different? And then the last question, I'm not going to talk too much about this yet because we published a separate paper in response to this. So I'll talk more about that at the end of the presentation. But to what extent is the policy response to the epidemic considered, or could it be considered trauma-informed? And so I think you can probably tell there is different levels of subjectivity in these questions. So the first two, I would say, require a medium or maybe minimal degree of interpretation. So you do have to read the policy to see what its goal is, but that's going to be in there. That's going to be probably fairly clear. The same thing with the population. It's probably going to say, if a particular group is targeted. But the second two, I would say, are more interpretive. Policy is not necessarily going to say, like, yes, the goal of this policy is to punish people, or conversely, this policy is intended to be trauma informed. So you really have to kind of read between the lines and interpret. So that's just an illustration of that. So the next step, once you have your research questions, is making sure that you have a way to get data on the policies that you want to analyze. So in the US, at the federal level, the national level, this is pretty easy because we have a nice, I would say pretty easy to use data set called congress.gov. So this contains pretty much every bill or resolution, and a resolution is similar to a bill, it's more symbolic rather than legally binding. But in any case, congress.gov has the full text of pretty much any bill or resolution that's been proposed in Congress going back many, many years. So not just the ones that passed and became laws, but anything that was proposed. So it's actually pretty easy to go in there, and if you know what you're looking for, to find that information. So we knew right away, I had used this, a little bit before for other projects. We knew we could use that to build our data set. I know in the US, some states have a similar data set. So New York State, for example, if you wanted to search prior legislation in New York specifically, there is a separate database for that. I don't know what's available, where you are in Turkey or in, say, the EU or in other places. So that may be something that we can chat about. I'm curious about that, but this is what we used in this project. So once you know your data set, the next thing is thinking about inclusion and exclusion criteria. So how are you going to narrow things so that you have a feasible set of policies to work with? So one thing to think about there is what time frame are you looking at? And with the opioid epidemic, that was also fairly clear. So we said 2009 as our start date, and that was based on going back and looking at the media, looking at when, this first started to really, I think the epidemic really started before that, but when it started to really be talked about as a problem and come up in the media and come up in politics was around 2009. So we made that our start date. I think we were starting to do this project, it was 2018. So we made 2017 kind of the cutoff point. And then we did a simple keyword search in this database. So our goal was to find any policy that was relevant at all to opioids and the opioid epidemic. So we had to search for a couple different terms like opiate, opioid. Those terms are used kind of interchangeably in the US at least, heroin, things like that. And then we were polling and looking at any policy that came up in response. So a few tips to keep in mind with that. One is maybe kind of obvious, but just you need to think about if there's synonyms or any relevant search terms for what you're looking for. Because of course, if we only search this word opioid, these terms are different spellings, but used often in the same way. If we only used opioid, we would have missed any policy that contained this other version of the word opiate. So that's something to be very careful about. And also just to get familiar with whatever search engine you're using or database to know if there's specific ways, truncation, if you have to use quotation marks, things like that. A few other things to note. And I'll say a little bit more about this soon, but this process of finding the policies was slightly more complicated than we expected because of these issues. So one thing we quickly realized was that it's common that the same exact bill or resolution will get introduced in multiple sessions of Congress. So for example, a senator has an idea, they introduce it in 2009, but let's say it's not successful, it doesn't pass out of the committee. So they come back the next year, 2010, they introduce the exact same thing. It goes back in that congressional record. Maybe it doesn't pass that time, they wait a year, 2012, they do the exact same thing. So we would see the same policies coming up. And we really wanted to make sure we were coding unique, different policies. That was our goal. So we had to think about how do we identify when a policy is introduced multiple times in Congress, and then make sure we're only looking at it one time so that doesn't distort the database. Similarly, we noticed it was also common that a policy, the exact same thing, could be introduced in the House and the Senate at the same time. So you have two identical policies. It's just one was introduced in the House, one was in the Senate. So we wanted to make sure we only counted those once as well. And then the third thing was we noticed there were smaller, more targeted policies that sometimes would get subsumed into what I call parent bills, larger pieces of legislation. So we also wanted to keep track of that and only code the bigger pieces because those incorporated those smaller policies. Yeah. All right, so let's move on to step 4 here. So this is coming up with your code book. So what are you going to be coding for once you dig into that data set? And so the first part, and this was pretty easy and informed by just looking at other types of studies and what they did. This is what I call basic policy information. So this is kind of similar to if you do a study with people, you would report some standard demographics at the beginning. I see this as similar. It's just kind of standard basic policy information. So at least in this context in the US, this included things like the policy type. So was it a bill or resolution? The status, was it simply introduced and never, went anywhere else? Or did it pass one chamber, pass the House, or pass the Senate? Or did it actually become law? Where did it originate, in the House or the Senate? What is the political party of the sponsor? Legislation can be co-sponsored. So we look to see if there was bipartisan co-sponsorship, meaning at least one sponsor from Republicans and one sponsor from Democrats, which are our two major political parties. And then is there any funding attached to it? So back to our research questions, we had to think about what codes would we use to be able to answer those questions. So remember, the first question is, what is the goals of these policies? So this actually was a little bit complicated because there wasn't really any standard taxonomy or categories already out there to use. So we had to review the literature and make our own taxonomy, and I'll show you that in just a moment. The second one was a little easier. So that question was, what are the target populations of these policies? So for that, we were able to kind of quickly think through some of the potentials. So young people, racial and ethnic minorities, veterans, people with co-occurring disorders, those are just some of the examples. And then that third research question was, is this policy considered punitive or not? And remember, that's pretty subjective. So for that, we just had a dichotomous code of, yes, we consider this to be punishment oriented. So, talking about incarceration or legal penalties, things like that, or no, not punitive oriented. So this is the taxonomy that we came up with. And again, this took some time to put this together. So we read a bunch of articles, read what different people were saying about what could be done in policy for the opioid epidemic, not necessarily what is done, but what could be done. And so in the right-hand column under illustrative mechanisms, that's kind of where we started, was reading the literature and just kind of jotting down. So for example, we found lots of articles talking about naloxone access. Naloxone is a drug that you can take that if somebody's overdosing on an opioid, if they take naloxone, it reverses the effect of that overdose and can save the person's life. So we saw lots of stuff about, policy could make it easier for people to get naloxone. So that's just one example. So we read, all kinds of stuff, all kinds of different ideas, came up with these different mechanisms. And then what we did was kind of group the mechanisms into some bigger buckets. And that's what we use for coding. So this left column, the goals, that's what we were coding. It was a little bit too much detail to try to code these very specific mechanisms. So what we were recording was, what bucket do the goals of any particular policy fall into? So some of the examples of those bigger goals or bigger buckets are things like overdose prevention or mitigating the effects of overdose, supply reduction of prescription opioids. So basically, how can we get doctors to prescribe fewer opioids or prescribe in ways that would be safer? Number 3, how would we reduce the supply of illegal opioids, such as heroin? Number 4, and I think this is especially interesting, is demand reduction. So the reason why people use opioids in the first place usually is for pain medication. So how can we, reduce demand by maybe having some non-medication ways to treat pain, things like acupuncture, alternative treatments. So that was one area, and so on. So I'm not going to read all of them. This actually goes on to a second page. So we had a total of 11 possible coding categories for goals, including an other category to have kind of a catch-all for things that didn't fit neatly into these other categories. And of course, the policy can have more than one goal. So we built our coding to allow for that, because you might have a very long legislation that's trying to do multiple things. So a policy could have as many as 11 goals. I don't think any had all 11, but that the way we coded, that would have been possible to record if it did. So back to building our data set. So remember, we're using congress.gov. We use those keywords, we put in our dates. And when we did that, Initially, we got 357 different policies, so 357 bills and resolutions. But then we realized we had a lot of cleanup to do because of the issues that I mentioned earlier. So the first thing that we did was, upon reviewing these policies, we realized that 28 of them, they might have had the keyword in it, but they were about something else. They didn't really address opioids in a substantive way. So right away, we could take those out. Next, we found 57 that were essentially duplicates because they were introduced in multiple sessions of Congress. So in that case, we just held on to the most recent version and got rid of the rest so that we weren't coding the same thing multiple times. Next, we found 55 that were introduced in the House and the Senate at the same time. So just for consistency, we retained the House version. They were exactly the same though. And again, got rid of the rest so that we weren't doing duplicate coding. And then lastly, we identified 29 smaller bills that eventually got incorporated into larger parent bills. So in the end, we were actually only looking at 188 different unique policies, not 357. But I will say that's a pretty painstaking process. We had to read each of the policies to kind of figure out, what was a duplicate and what wasn't. So just building this data set took quite a long time. And then we made a pretty simple Excel spreadsheet to do the actual coding. So we would number each policy, we put in a hyperlink there to link the policy to the full text in congress.gov so that it was easy to go in and read the policy. And then across those columns in Excel, we just put the different coding categories, and that's where we recorded our codes. So that's the next step, is actually doing this coding. So I mentioned that I had a colleague that I did this project with, Andrew Irish. So he and I independently coded everything. You could do this with just one coder, but I think like with many types of analysis, you increase the rigor when you have more than one person, because you're not just relying on one person's interpretation then. So in this case, both Andrew and I independently coded everything. So I had my Excel spreadsheet, he had his. We didn't look at each other's while we were coding. The coding also takes quite a bit of time because you're reading all, or at least skimming, pretty much all or sometimes targeted parts of a policy if it's only part of it that pertains to opioids. So that takes a long time just to read it and then to apply those codes. And as I mentioned, a policy can have more than one goal. It could also address more than one population. So sometimes we're, using multiple codes within those categories. One thing we did that was very helpful is having a notes column. So we would each independently code, but then we would also each make notes of, I thought, the goal was this because the policy mentioned this specific thing. And that was really helpful because when you're looking at that many policies, it's easy to forget kind of your reasoning and what you're looking at. So I would highly recommend that. And then Andrew and I would meet after we would code about 20 to 30 policies. And so that we could talk about, we would compare first to see if we agreed or disagreed. And then if we had disagreed, so coded something differently, we had to talk about that and then resolve it by consensus. So that also is time consuming because often that means having a discussion, going back, looking at the policy together, and then coming up with a way to code that we agreed upon. But we did all that, and then we were able to track our ratings and calculate our inter-rater agreement. So the last part, this I think is the easier part. The hard work is everything that I've just talked about. Once you're done coding, then you have a nice, coded data set, and you can do whatever you want with that. So in our case, we didn't really do any sophisticated analysis. We were pretty much just using descriptive statistics to answer each of our research questions. And a couple of the things, I'm just going to very briefly summarize it. A couple of the things we found. One is that, maybe not surprisingly, most policies don't go beyond the introduction stage. So we were looking at all these different things that, had been proposed in Congress. And just it's important to remember that the majority never do become law. The majority are just put out there, introduced, but for various reasons, don't go on to become official legislation or to become passed resolutions. So that was one thing. In terms of the goals, and this I thought was interesting, we found that the opioid policies mainly focus on short-term treatment solutions or supply reduction, so making fewer opioids available, not as much about demand reduction, not as much about reducing stigma, very little in terms of things like safer drug consumption and harm reduction, not a lot about even long-term recovery support. So that really pointed, I think, to some real gaps in the policy response. We did also find that the policy was mostly non-punitive, so 91% we coded as non-punitive. So that was also interesting, since that does represent a departure from kind of the nature of the previous drug policies in the US. So I wanted to briefly talk about that other example. So this was based on the same data set, but we published a different paper on it. Just there was too much in these findings to put it all in one paper. So the paper I'm referring to here is Bowen and Irish 2020. This was in the journal Psychological Trauma, Theory, Research, Practice, and Policy. And the title was Trauma and Principles of Trauma-Informed Care in the US Federal Legislative Response to the Opioid Epidemic, a Policy Mapping Analysis. So backing up a little bit, I have always been interested in this idea of trauma-informed policy. So in social work, we talk a lot about something called trauma-informed care. And so this is the idea that a lot of people have been through some kind of trauma in their life, and that when they come to us as social workers, so when they come seeking mental health care or some other type of social service, the trauma that someone's been through often affects how they present and if they're even willing to seek help in the first place. So in social work, we've promoted this idea of trauma-informed care, meaning that our social services should be designed with an understanding of trauma. So recognizing that somebody may have trauma, trying to make sure that person feels safe when they seek services, really trying not to accidentally re-traumatize them in that process. So in 2016, a colleague and I published an article basically arguing that you could use these same principles of trauma-informed care also in policy. So not just in services, but that our policies could be more trauma-informed. And so we had published that a while ago, but I was interested in applying that, and specifically applying that with opioid policies. So that's what this second paper was about, was do we see these principles of trauma-informed policy in this same body of policies made in response to the opioid epidemic? Because obviously there is a big link between trauma and addiction, including opioid problems. So I thought, it'd be reasonable to see if there is reflection of these trauma-informed principles in this body of policy. Was there a question? Yeah.
I think someone is unmuted.
Oh, okay. No questions? Yeah.
Betsy, we can ask our questions in the end. I think everyone's noting their questions, if that's okay for you.
Yeah, that's fine. And I'm almost at the end.
Okay.
So that works.
Thank you.
Sounds good. So in any case, this is a table from that article, and I'll just kind of briefly describe it here. So on the left, these are our principles of trauma-informed policy, and then a description of what it is, and then some examples of what this might look like in opioid policy. So for example, one principle is safety. So how can policy make the target population feel physically and emotionally safe? So I mentioned naloxone earlier, the drug that reduces opioid overdose. So for example, policy can promote safety by making naloxone more available. And then the other principles are choice. So how can policy maximize choice and options for the target population? Trust and transparency. So how can policy be transparent about its goals and kind of make that an explicit part of the policy and use that to build trust with the target population? Collaboration and peer support. So collaboration can be incorporated into the policy making itself, as well as having peer support as a goal of the policy. Empowerment. So how does policy provide opportunities for the target population to directly take action on the issues that affect them at a community level? And then lastly, intersectionality. So how can policy demonstrate affirmation and respect for the different parts of someone's social identity, including their race, their ethnicity, language, gender, sexuality, and so on, and the privilege or oppression related to that. So we were looking basically in these opioid policies to see, do we see these principles reflected, and in what ways? And so I want to just point out that I think is clearly very subjective, because often a policy is not, going to say like, yes, this is meant to be empowering, or we're going to try to give choices to this population. You really have to read between the lines and interpret. So that also was a time-consuming process to do that analysis. But Andrew and I did that, and actually, even though it is very subjective, we still had really good intercoder agreement. So I just say that that's possible, that even when it is something very interpretive, I think with good coding, good training, you can actually do this with a high level of intercoder reliability. I would say though, just again, to allow extra time, and because this is so interpretive in the cases where we didn't agree, again, it involved a lot of time to talk about that and to reach consensus. A couple of the findings, just briefly, we found 10% or so of the policies directly reference trauma. And then in terms of those 6 principles, each of them was reflected in between 7 to 38% of the policies. And we found safety was the one that came up the most often, and intersectionality, the last one I mentioned, was the least common. So to me, that also shows some big gaps. I think there could be a long way to go to make this policy response more trauma informed. So to wrap it up, just a couple kind of tips and things to consider moving forward. First, I thought I would mention what I consider some of the pros and cons of this methodology. Pros, I think this is a concrete, practical way of doing meaningful policy research. And I'd say the biggest part of that is, as I said at the beginning, the idea is not just to do this, for academia, but you could use this for advocacy. You could use this to point out what the gaps in the policy response are, and hopefully to advocate for policy that would help to address those gaps. So I think that's really the biggest positive of this. And I will also say, it's time consuming, and I mentioned that as the number one con, but it doesn't require a lot of funding. You don't really need, other than time, you don't really need a lot of money or resources to do this. You need at least one person. It's ideal to have 2 or more people. You need a laptop and maybe internet and an Excel spreadsheet, but that's about it. So those are the positives. The cons, I would say, as I mentioned, it is very time consuming, and I don't really know any shortcuts to it. Just to read and analyze so many policies, is bound to take a lot of time. The scope will always be limited, meaning you can't, look at everything. So even just by, say, focusing at the federal level, that means we're missing out on presidential executive orders that might also be relevant. We're missing out on state level policy. So you have to make some choices. And that means you're not going to be able to look at everything that's relevant to whatever issue you're studying. And then I think the other big con is that because this is time consuming and because policy is always changing and moving, there is that risk that maybe it gets, outdated even as you're doing it. So maybe you're analyzing policy from the last 5 years, but a new bill, major legislation gets passed today, that might make some of the past stuff perhaps irrelevant. So that's the risk, is the timeliness of it. A few questions to ask yourself if you're thinking of using this methodology. Number one, I would say, is just to make sure, can your research question be answered through policy mapping methods? Because of course, there's many other ways to analyze policy. This isn't necessarily the right tool for every job. So that's the first question. Number 2 is to check, is there data on your policies available? So we use congress.gov, depending what context you're looking at, to make sure that that information is available and to think about how you're going to access it. Number 3, think about who you'll work with. You can do this alone. One person could do a policy mapping study, but I do think there's a lot of benefits to sharing it with at least one other person to share the workload and to increase the rigor. How much time do you have? Since we talked about how this is time consuming, I found with this project, we had to spread it out over, it probably took close to a year, to build the data set and do the analysis, because we would spread it out and kind of do a little bit every week. So thinking about that aspect. And then lastly, what do you hope to do with the findings? Because that may also affect the timing and things like that. And then lastly, just a couple tips for what to do with your research once you're done. I think it's ideal. The most important thing, of course, is to find a journal that's topically related to what you're studying. But ideally to find a journal that publishes a fair amount of policy research and has specifically published policy mapping before. We found in publishing these two articles that reviewers, didn't necessarily always understand policy mapping. They hadn't always used it themselves. So when you have a journal that's already published it, I think that increases the chance that the reviewer will understand it. And we also found that we had to really explain it though. So I would keep that in mind, like don't assume your reader or the reviewer is going to know this methodology. You may have to really justify it and explain it. We also found we had to situate it within kind of the body of the journal, or sometimes even in the body of what I think the reviewer's discipline was. So one of our papers, I suspect, was reviewed by somebody in political science, for example. That's not my background, but they were bringing up all this political science literature that they wanted us to add. So, we had to think about that and we had to figure out how to add it. And we did, and made the reviewer happy, but that's just something to think about. Conferences, I think, are also a great way to disseminate this work. And then lastly, I have not always done a good job of this, but I do want to emphasize this is work that's potentially of interest to the public. We're talking about, real policies, real impact, real people. It shouldn't just, live in academic journals. So you can think about things like sharing on Twitter, blogs, other forms of public scholarship. And in my case, Andrew and I did record a podcast episode about our findings, which you can link to there. So that went a little bit long, I'm sorry. Let me just wrap it up. I do want to give thanks to two collaborators here. One is Andrew. He was a PhD student at the time that we did this, but recently graduated and will be starting his first academic position soon, which is great. And he was certainly very essential to this research. And I also want to thank Elizabeth Lightfoot, who presented on this topic of how to do policy mapping with Andrew and I at the Society for Social Work and Research Conference. I think that was back in 2020 when we presented. I've included some references as well as a couple other recommended readings. And I did want to mention I'm happy to share this presentation with Aslıhan. I can also share, any papers or anything that's of interest. So Aslıhan, I can email that to you after if you want to make those available to people. I'm happy to share any resources.
Sure, yeah.
So thank you. I will stop sharing and we can talk about any questions.
Yeah. Thank you so much, Betsy. I really am impressed by the amount of work you put into this. I can imagine how much you worked. It's intensive work, really. And we have a few questions on chat, and I'm sure people are gonna ask their questions as well outside of the chat. So the first question is coming from Dr. Kayaoğlu. By the way, a lot of my colleagues are listening to you right now, which is really exciting, from different disciplines, including social work. So Ayşegül Kayaoğlu says, we can also see the questions on chat, by the way.
Okay.
He says, it seemed to me that policy mapping is indeed very similar to the quantitative text analysis. If you think it has distinct characteristics, can you please elaborate them?
Yeah, great question. I agree with you. I think it is very similar. And I have used other types of content analysis and other research, and it's very similar. So I don't think there is much that's distinct other than the fact that you're applying it, to policies, public policy and legislation rather than other types of text. And because of that, there's particular things to consider, like some of the things I talked about of, looking at your data set to see if the same policy is introduced multiple times in the time period that you're considering. Some policy analysis really, or policy mapping gets into, we did not do this, but you can get into other types of analysis. So for example, looking at, is there a difference if we want to compare, the bills introduced by Republicans versus those introduced by Democrats? you could do some kind of bivariate analysis to see, is there a difference in the goals of those bills? We didn't really have a reason, I guess, a theory-based reason for doing that type of analysis. So we didn't. So I think the way that the specific questions you ask, the type of analyses, the factors you look at, like that will all obviously be shaped by the fact that it is public policy. But other than that, no, I think in terms of the methodology, it is essentially the same as using content analysis, or as you call it, quantitative text analysis. I don't really see a major methodological difference.
Betsy, I think people are asking something about to differentiate qualitative versus quantitative, because there's another question regarding that. Fatih Aysan says, it seems it's a quantitative content analysis, not qualitative. He asked before I share this question. Can we say it is quantitative, or is it qualitative analysis?
Yeah, that's a great question too. I consider it to be quantitative because ultimately, you're not looking. I do a lot of other qualitative research, not in policy, but with other topics. And I think of that as quite different, where you're, looking for qualitative themes. I consider it, at least the way I use policy mapping, to be primarily quantitative, because ultimately you're taking text and you're coding it, you're distilling it into quantitative units that then you do some type of either descriptive or bivariate or multivariate analysis with. The only thing I would add to that is I would say it's quantitative, but as I tried to emphasize in the presentation, just because it's quantitative, doesn't mean that it's not subjective. So I think there is still this subjective or interpretive element to it. And that comes in that coding process of, even just coding the goals of a policy. There is some level of interpretation there, some level, there's room for some human difference that I might read it and, think the goal is one thing and I'm going to code it this way. And my colleague, because they're coming at it from a different perspective, they're going to read it differently and interpret it differently. So I do consider it to be quantitative, but just with the caveat that quantitative doesn't always mean, strictly objective, that there is often, I think, a level of subjectivity and interpretation to it. I see there was a question within that about software. We actually did not really use software. I imagine there must be ways to do this with software. We just didn't really find it necessary. We put everything in the Excel spreadsheet. And then it was just a question of entering our codes within that spreadsheet. When we were done coding, I typically use Stata for my analysis. So then I'm trying to remember, it was a couple of years ago, I believe we did then export, the final coded data into Stata, just to use that for calculating our descriptive statistics. But that was it. So there may be other software that could make this easier, but we, I guess, kept it kind of simple and basic.
Thank you, Betsy. There was another question by Dr. Aysan. He's asking, is this method frequently used in social work and other social science disciplines like public policy, sociology? Do you think it's used frequently?
I would say not frequently. Again, the field I see it most used in is public health, for whatever reason. And, in social work, what I'm most familiar with, I don't think I'm the only person using it. I can think of some other social workers using this or very similar methods. So I do think you will see examples in public policy, sociology, social work, but I would say it's still, I don't know, at least in social work, I don't think it's super common. And again, I know that from my experience of publishing, even this recent article that we published in a social work journal that was just meant to be a primer, like a how to do policy mapping, very similar to this presentation. Some of the reviewers of that article were not very familiar with it. And at first were, asking questions of, what is this and how is this different from other methods? So I think it's still relatively uncommon, I guess, maybe because there just are so many other methods that also can be used to do different types of policy analysis. So I'd say becoming maybe more common, but still not super common. I think there is interest though. When I presented on this at a social work conference a few years ago, we had a lot of people attending. I know at least one person from that followed up with me, and they ended up using this methods in their own work and were able to publish something on it. So I do think there's some growing interest in it.
Thank you, Betsy. Another question, Wayne Nishanje is asking, is there a way for incorporating relevant theories into the analysis? For example, can you incorporate the critical race theory or the critical legal studies perspectives into such studies?
Yeah, that's a great question too. And I would say absolutely. And I think the way that you would do that would be the theory would inform your coding. I mean, it would inform your research question too, but I think it would inform your coding. So in the same way that we used this concept of trauma-informed policy to code, do these policies look at or incorporate principles of safety and choice and intersectionality and so on. I would imagine, let's say with critical race theory, that if you're coming at it from that perspective, there might be particular things you want to code in the set of policies that you're looking at. So I would use the theory to inform your choice of coding categories as well as your research questions. And I wish, I can't think of an example of a study doing that off the top of my head, but I think that would be an excellent idea. I think there could be a lot of implications of that to see, a critical race analysis of a particular area of policy. I imagine it would probably point to a lot of interesting gaps and findings. So that makes a lot of sense to me.
Yeah, it seems like research questions are quite flexible. There is no fixed research question, so you can ask any kind of question as far as I understand. Yeah. The Venetian says, just a comment, if these types of analysis are a combination of qualitative and quantitative methods, in that there is a subjective element to the quantification, machine learning models might be very helpful.
Yeah, that's, I think, a great point too. And again, considering how time consuming it is to do these the old fashioned way, machine learning could be super interesting to see, right, how you would have an algorithm do coding and what that would mean. And I can't think again of a specific example off the top of my head, but I imagine someone must already be experimenting with that. And I agree, that's a really interesting area for growth here.
Betsy, can you think of any example of a multivariate analysis that you did with this policy mapping? Because I cannot make it concrete in my mind.
Yeah, we did not do any multivariate analysis. We just kept it pretty much descriptive, because to answer the research questions, they didn't really require multivariate analysis, but you could do that. So for example, again, you could build, say, some kind of regression model if you wanted to see, again, I'll just use this as a simple example. Does the political party of the sponsor of a piece of legislation impact, whether or not that policy is punitive? So that's an example. Are Republicans more likely to sponsor policy that's punitive? So you could do that and then test it, in a model where you have the major independent variable, Republican versus Democrat. You could control, for year of Congress and for some other factors, and you could see if that's significant or not. So we weren't, that wasn't a focus of this particular study to compare Republican versus Democrat. I just use that as an example. But you could do that type of thing. And I'm sure there are studies that do that type of multivariate analysis in policy mapping.
That sounds really exciting. And Ayşegül Kayaoğlu says, actually, one can already use R to this type of analysis.
Yeah, I wish I was better with R. I feel like that would be worth learning. That's a good point.
Yeah. And I think this is really exciting, by the way, the possibilities of what we can do with policy analysis with this method. But I think it is limited to like the intended goals that are on paper, right? We're not looking at the unintended consequences of the policies or the real influence of the policies on the populations that are targeted.
Yeah, that I think is a good point too, in terms of limitations. So it's really, I think policy mapping is good for looking at what's been proposed and what's actually been passed as well. And that, of course, is a starting point. But you're absolutely right that policy analysis can go well beyond that, because we know that even once the policy is passed, how it actually gets implemented, like, does it get implemented? What impact it ends up having? Does it actually achieve the goals that it's supposed to? Like, those are all, very important questions. And this is not the technique to look at the answers to those questions. So yes, I think this is why it's one tool, I think, for looking at policy, but certainly not the only tool we want to have in our toolbox of policy analysis. Absolutely.
Yeah, we passed 1 hour already.
I know, the time went fast. Yeah.
Yeah, time is flying here. Any other questions for Betsy or comments? You can unmute yourself and ask, or you can type on chat comfortably. Yeah, they're thanking Betsy.
Yeah, thank you for coming. It's, I appreciate it. I know it's evening. It's hard to make time for things, and I really enjoyed this chance to talk with you all. Thank you.
Yeah, but Betsy, one last question. Have you ever seen anything on like comparison of policies in different countries, states using policy mapping?
Yeah, that's also a good question. And no, I was thinking about that, just knowing I was, presenting in an international context. Again, it may have been done, but I have not. I hate to say it, I'm pretty much only familiar with these United States-based examples. Again, there's no reason why you couldn't do this, to do some kind of comparative analysis, or looking at even international, like charters or something like that. Or, looking at other countries specifically. Yeah, I see someone commented, a paper analyzing the UN speeches of countries about climate change. Yeah, perfect example. So I think there are a lot of ways to think about it, but I admit my my background is, in what I've read, is pretty much all been based in the US. Yeah.
Yeah. Okay, thank you so much again, Betsy, for this inspiring talk, and we look forward to seeing further work for you, or from maybe us, maybe in cooperation. I don't know, we will see. Yeah, and thanks everyone for your contributions and being here. Thank you, Dan, Betsy.
Thank you so much.
Great, thank you. And feel free to follow up with me. You should have my email address, and I'll also share the presentation with Aslıhan to share with you. Thank you. Yeah.
Thank you so much. Thank you.
Okay, thank you. Bye.
Thank you. Have a good evening.
Bye, everyone.